This is the Emergency Medical Minute, sponsored by Mile High Ambulance.
All right, so good evening. Happy Thursday. So this is actually going to be a two-part medical minute. So the first part is going to be a little about the case and the initial treatment. So this was a case that we had a couple weeks ago. It was a 60-ish-year-old guy who came in with pretty vague symptoms, not feeling well, a little short of breath, not eating or drinking very well. Didn't look great, but nothing too specific. So we ordered labs and did an EKG as part of the initial workup. And the initial EKG looked a little funny. It had pretty wide QRS complex. We didn't have anything old to compare to. We definitely thought about possible hyperkalemia, so I was curious to see what the potassium would be when it came back. But he looked okay, so we were just kind of waiting for labs. And then I wasn't really paying close attention. I heard something about his labs being hemolyzed and they were going to get resent. And then it seemed like it was taking a while for his labs to come back. So I said, hey, can we call the lab again and see? And they said, yeah, the second one seems hemolyzed too. I said, well, can you tell us what the potassium is? They said, well, it's 9, so we're sure it's hemolyzed. I said, well, what's his creatinine? And it was 26. And his BUN turned out to be like 220. So it was probably not hemolyzed the first time, and they just kind of assumed. So, a couple kind of interesting points about that is, first thing, if we're really worried about hyperkalemia, someone who doesn't look great and they have a QRS that's really wide, we don't have point of care anymore, as we all know, which would have been really nice. Just do a quick epoch and we could have found his potassium in 30 seconds. But you can ask the lab to run a venous blood gas with electrolytes. So if we draw a VBG and specifically tell the lab we want electrolytes, they can get us basically a point of care testing in, 15 minutes or so. That's the first thing. And then the second thing is when the lab, says they have hemolyzed blood on someone who's critical, we should ask what those results are. And then also, it's probably not a bad idea to ask, well, what's the potassium, what's the creatinine? If the creatinine's normal, then, a potassium of 7, could be very well hemolyzed. But if the creatinine's really abnormal, it should make us think kind of twice and try and do something kind of more urgently. So that was kind of the first part. Second part, I was going to talk about, us kind of getting the patient ready to be dialyzed emergently, just not something we do all the time here, putting in dialysis catheters. There were some questions that came up on that. I was going to talk about that next time I do a medical minute. Thanks, guys.
Hey EMM, it's Mason here to tell you about an exciting new opportunity we are offering. In an effort to tangibly improve our organization's commitment to equity, diversity, and inclusion, we created the Diversity and Inclusion Award that fourth-year medical students that identify as underrepresented in medicine and are applying to emergency medicine residencies are eligible to apply for starting today. We understand that the cost of applying to residency adds up, and we want to do what we can to ease that financial burden. We are extending 3 $200 awards to selected individuals following a blinded review of all applications. Applications will be accepted through the end of November, and winners will be announced mid-December. Check out our website at www.emergencymedicalminute.org/EDI-award for all the details and to access the free application, or click the link in our show notes. Thank you.